here today.
Oh, yeah.
Welcome to Power. Let me hear ya.
Power.
Presenting opportunities where everyone rises. And with me today, I have my husband, John Vaughn. Put your hands together. Yeah.
Wait. Did y'all hear what she just said? Say it again. Say that one more time.
I said today I have my husband, John Vaughn, here with us today. Put your hands together.
Might be the last time. Y'all come on now.
So Power, presenting opportunities where everyone rises. We come every Wednesday.
Every Wednesday.
To empower our community, especially the underemployed, the unemployed, and our seniors. We're so glad that so many of you have come out today. Put your hands together for yourself. In this place. Oh, appreciate yourself. One more time. Clap it up. And then our audience has expanded because we have Facebook friends and YouTube friends that are not in the building. Turn to that camera and tell them you should be here. That's right.
Can I do something real quick?
Go ahead.
Listen, everybody pull their phones out real quick.
Oh, that's a good one.
Pull your phones out real quick. I know you got a phone. Do you know how to turn it off or silent? If not, one of our Bright Star workers will help you turn your phone off, all right, or silent. Y'all do that for us, all right? But before you turn it off, hit share. Hit like and share.
Oh, that's a good one.
So we can share this program. Let me just tell you something. You may not be in the house, but we had at least over 1,500 viewers last week.
Online?
Come on, online. Woo! That's through Facebook, YouTube, so we have to share because we don't want you to be the only one get this information.
That's right.
All right?
That's right.
Will y'all do that for us? All right.
All right. Thank you so much for that. All right, so we have some forms on. I know we give you a lot of information, people presenting, and on your table. Please take the time to fill out the information so that you can, listen, I can't even really say what I want to say, but there's always a blessing for you if you will just take the time to fill the paperwork out. You see those little referral forms? We're going to come by today and pick those up before the end of this session so that we can invite the people that are not here that you've asked us to call, okay? And speaking of that, we got a winner, don't we?
We have a winner. She was referred. Her name is Olivia Hurst.
What? Where's Olivia?
Where are you?
Olivia.
She's over here.
Hey.
All right.
Come on,
Come on, let's put our hands together for Miss Olivia.
You just won a $25 gift card. Go to that back table over there, and we'll be able to give it to you.
Now,
Clap
Miss
it up,
Olivia,
everybody.
it's important that you fill out the referral because somebody else can win $25 next week.
That's right. That's
Come on, let's put our hands together for her.
We got a video coming up. Please stay tuned for this information. We'll be back.
See ya.
The COVID-19 pandemic has brought social and racial injustice and inequity to the forefront of public health. As a matter of fact, in response to the pandemic, BSCO established a functioning health department focused on social determinants of health. As we know, health equity is still not a reality, and as a result, COVID-19 continues to disproportionately affect Black and Brown communities, putting them at more risk of getting sick and worse, dying. Residents may not trust their doctors, but they sure do trust their faith leaders. Therefore, Pastor Chris Harris partnered with Northwestern Medicine to create a health show called Clergy and Clinicians. As a trusted voice in the community, PCH, African American, and Latinx medical professionals have come together to address concerns in communities of color. With episode reaching over 100,000 views, residents are educated on issues such as COVID-19, heart disease, organ transplant, and mental health, as well as many other health disparity-related topics. BSCO and its collaborative partners have been committed to bringing free vaccines to our community, studying long-term effects of COVID-19, and helping to close Chicago's life expectancy gap. We have disseminated information that educated our residents while sharing facts and breaking down stigmas about the virus, variants, and vaccines. We were also able to provide free vaccinations to our residents, which helped keep them safe and alive. At the same time, it created a safe space for residents to come in and participate in peer support groups. These groups became a long-awaited beacon of light, where residents found hope and created a sense of community as they voiced their challenges, difficulties, and mental health frustrations during and post-COVID-19. With 15 community events, these specific efforts have resulted in a collaborative that achieved over 15,000 vaccines to the residents on the south side of Chicago, and 250 residents participating in a nationwide long COVID study that will help shape the way COVID effects are treated in underserved Black and Brown communities and generate up to $800 more to their household income. Our team of individuals brave the streets of Greater Brownsville daily in hand-to-hand marketing, gathering data through surveys, ensuring the voice of our community is reflected while we produce new health-focused programming. Doing things with the community and not to the community is the principle of our work. Very few community-based organizations can say that they have the privilege of partnering with globally respected medical institutions like Northwestern Medicine, UChicago Medicine, and now St. Bernard Hospital, providing mental health services to their staff. At BSCO, the health of our community is one of our highest priorities.
Power. Y'all make some noise up in here. Power. Come on, let me hear y'all make some noise. Power. I got one simple request. If you got anybody good looking at your table, make some noise for them right now. All right, that was kind of okay. Now, if anybody at your table didn't make no noise, they clearly don't know who they sitting with. Some of the best, some of the baddest, some of the brightest. One more time, if you got some power sitting at your table, make some noise for them right now. Come on. I'm excited about this. And I'm Pastor Chris Harris, founder and CEO of Bright Star Community Outreach. And I get the privilege to hang out with you all every single Wednesday for these power sessions. It has been amazing. And I want to thank all of you all that are here on the scene. And y'all do me a favor, go crazy for the over 1,500 people who watched on the screen. Go crazy for our online viewers. Oh my goodness. Now, I need y'all to take those phones, text a few people. Say, are you tuning in to Power? Power represents listen, this acronym is one of my favorites. Presenting opportunities where everyone rise. And I decree and declare that everybody at your table is going to be rising, going to the next level. And if you believe that, make some noise in here one more time, everybody. Those of y'all that are watching by way of online streaming, would y'all do me a favor? Would you take that link and would you share it? Share it on your page. Those are who you're in your sphere of influence. And if you got any folks who are in your family members who are on social media, you can grab the link and you can text it to them and tell them to tune in, especially seniors today. Not just exclusively, but specifically seniors that are in your life. There's so much education that's going to take place. Now listen, we're going to be blessing people with wins and all of that good stuff, but I want to just share with you, I'm excited. Are you all enjoying your food today? Is it all right today? Y'all having a good time today? That is amazing. And listen, our facilitators, John Vaughn, Joni Vaughn, y'all got to give it up for them. Come on now. Just amazing folks. And we are so grateful. I got some amazing guests with me here today, and I'm pretty pumped up about it. And this organization, the Chicago Family Health Center, is here with us today. Power, welcome them in today. Come on. I'm pretty pumped up. We have our guest, Mr. Warren, is it Cummins? Yes. Mr. Warren Cummins, who is the program manager over there, and he brought some company with him today. Miss Brittany is in the house, so y'all give it up for Warren and Brittany. and I'm pumped up about having them with us. Would you both, first of all, take a moment, introduce yourselves individually, and then also tell us a little bit about the health center?
Certainly. My name is Warren Comas. I am the infectious disease program manager.
And use that microphone pretty close so they can hear you. There you go.
I'm the infectious disease program manager for Chicago Family Health. So over the HIV, STI programming, hepatitis C, all those sort of infectious diseases, we treat all those at Chicago Family, and that's my area of expertise. I have degrees from Northern Illinois University and Judson University.
Awesome. Thank you. Y'all give them a welcome, everybody. Miss Brittany, how are you today?
I'm great. Hi.
Tell us a little bit about you.
My name is Brittany, and I'm a health educator over at the Chicago Family Health Center. And I got my bachelor's at Northern and in health promotion, public health and promotion. And I'm just super passionate about just sexual health in general, and so testing, being able to test for the STDs and educate people about them is a dream come true for me.
That's amazing. Give her a welcome to power, everybody. So, Warren, would you start off, tell us a little bit about the Chicago Family Health Center. We want to understand about the organization, and then we're going to zero in, and we're going to talk about some serious stuff today. I'm excited about today's conversation, particularly for a few folks in the middle section. We ain't got to point them out just yet, but I can't wait to talk about it.
All right, well, Chicago Family Health Center is a full-service, federally qualified health center. What that means is that we see everybody regardless of their ability to pay. And we have 6 health centers throughout the south side of Chicago. We are in Pullman, South Chicago, Roseland. We're inside Chicago Vocational Career Academy. We're in Chicago Lawn, and we're over on the east side on 105th. So we have those centers. We offer adult medicine. We offer pediatrics. We have behavioral health services. We offer substance use treatment, including medicated assisted recovery for people struggling with opioid addiction, and dental as well. Got it.
And I want to just kind of frame this conversation today. Especially in black and brown communities, Warren and Brittany, we have things called food deserts and health deserts, and people don't always have access to quality health care. And so how do people pay for, the services? Is it affordable? Is it accessible? And let us know a little bit more about that which is available, because we have not only those who are on the scene, but we also have people who watch on the screen. Why would you tell somebody to come to your health center?
Well, we have a few ways to help people when it comes to paying for their health care. For one thing, we do offer insurance navigation. So if people need to sign up for Medicaid, medical cards, county care, the marketplace, when the marketplace is open, we can assist with that for people who don't qualify or are unable to receive that insurance. We are able to provide care for people on a sliding scale basis that is dependent on their income.
That's amazing. And so all of you all that are here today with us, it's important that when you get information, you share it with other folks. How many of y'all know at least 2 or 3 people that should be tuned in right now to get this information? It's your responsibility to text them. It's your responsibility to grab the link and share it with them, especially those of you all that are watching by way of online streaming. Now listen, today we're going to talk about seniors and sex. Yeah. Yes. Don't be turning your head, Mother Hall. Look this way. Come on. Mother Harrington, don't walk out now. Oh, no. No, we talking today. Let me tell you something. Now, he's not here today. Should be. Might be tuned in. But my father lives in a senior facility. And let me tell you something. When I walk in that building, now y'all can say what y'all want to, but these seniors still got swag. Now, they still got swag. I heard somebody say, what that mean? Let me say it a different way. You know, these seniors can still pull them. They'll be playing. They be flirting with each other. And I'm like, hold on. I said, Pops, you mean to tell me that they still be getting down in the senior facility? You know, my daddy told me, and I made the mistake of asking the question, Brittany, in front of some other folks who was in the room, and one lady didn't even let him finish. Like, you think we dead? Oh, man. And then when she said that, you know, my daddy had to go the extra mile. My daddy was like, that's right, I still got it, boy, that's right. I said, and I had to think about it. My grandfather, my mother's daddy, had a child when he was 74. Did y'all hear what I'm saying? I said, now wait a minute. And I was blown, and it was his baby, for sure. And I said, hold on, I didn't know. So I just didn't understand it. And then as I started to do this work around health and things like that, I didn't realize, and I was from my ignorance, that there are STDs, right, that happen in senior facilities. And I was like, whoa, I was amazed. So first of all, let's talk a little bit about STDs, because clearly this is not just a subject for seniors. It's a subject for people everywhere, regardless of their age. So just educate us on what an STD is. Who wants to take that first?
I will. So I'm less experienced with public speaking, so I've got my trusty notes.
You at home. Just be you.
Okay, great. Okay, so yeah, STDs are caused by bacteria, viruses, or parasites. The treatment depends on which kind of those that you have. So for example, the bacterial STD would be treated with antibiotics, and the viral, although it's not curable, it's managed by different medications. So that's kind of what an STD is.
Want to add a little bit to that?
Certainly. So there's a few ways that STIs, STDs pass around, and we'll talk a minute about the difference between that, or what people think is the difference anyway. But basically, you got several different ones out there: the bacterial STIs and the viral ones. The bacterial ones, you're looking at things like gonorrhea, chlamydia, syphilis, genital mycoplasmas. Those are the things that are very common moving around the community, and they're fully treatable, curable conditions. Then when you're looking at viruses, you're looking at things like HIV, herpes, hepatitis C, that a lot of times we can't cure them, but we've made a lot of progress, and everything at this point is treatable. And you know, even HIV is completely treatable at this point.
Yeah, I think one of our problems is we stay away from these subjects, right? They are taboo. People are afraid to even talk about it. Now, as a pastor of two churches, let me be honest. The church don't like to talk about sex. But church people love having sex. Now, we got to be honest about that, right? It's amazing to me. And we don't really understand that there's this principle in this book that I like to talk through all the time. We perish for the lack of knowledge. And we don't like to teach this not only in churches, but in our homes, and it's a taboo subject until somebody come home pregnant or until somebody come home with an STD. But wait, you just said something about an STI. Tell us the difference between an STD and an STI. What are the acronyms and what's the difference?
Okay, so the Planned Parenthood website explains it perfectly, so I'm just going to go ahead and read what they said. We get a lot of questions about the difference between STI and STD, and the answer is actually pretty simple. There isn't really a difference. STD stands for sexually transmitted disease, and STI stands for sexually transmitted infection. But no matter which term people use, they're talking about the same thing: infections that get passed from one person to another during sex. These infections have had many different names over the years: venereal disease, the clap, the drip, and most recently, STD and STI. STI is the most up-to-date term. Educators and healthcare providers switch from STD to STI because infection is more accurate and less stigmatizing than disease. So let's break it down. An infection happens when a virus or bacteria or parasite enters your body and your immune system kicks in to try to fight it. Disease happens when the infection causes symptoms, damages parts of your body, and leads to illness. Many infections never develop into diseases. Most of the time, STIs never even get to the disease stage. People may not even know when they have one. STIs usually don't cause symptoms, and they can often be treated or cured with medication before they cause long-term harm. And it's an infection, not a disease, that gets passed between people during sexual contact.
Let me stop you right there. Hold on. So I love this, but you said something key, that you can have it, but not even know it. And I would think at that moment, we got to kind of think about the fact that this is why our annuals are so important, right? Constantly going to the doctor, getting your checkup. Now, I'm not going to ask you to raise your hand if you've not had a checkup in the last year, but I do want to say that we have to be wise in what that checkup experience is, right? You may be checking for one thing, but one of the things I've learned is I go in and like check everything, right? Listen, first of all, I'm paying for it, right? If I'm paying for it, then I want to know. And then secondly, I have to be very careful because when you talk about STDs, STIs, if something can be, based on what you just said, if something, you can have something and not know it, could it be possible that it shows up on a later checkup and it missed the first one?
You know, actually, there's recently, seen a case where there's somebody who hadn't had sex in over 6 years, wondering why they're feeling so sick, why they're feeling so run down. They were HIV positive. They weren't even thinking that way. They weren't getting tested. They're like, I'm not sexually active. Haven't been sexually active in years. But they hadn't been tested in that time period. And the HIV had been slowly growing in their body and gradually over time reducing their immune system. You can have HIV for many years before you start to feel any symptoms, before you realize anything is wrong. And that's why it's so important to get tested because you just don't know. And a lot of the STIs, a lot of times there are no symptoms, particularly in the men. They don't even know they have them, and then they're passing them along to other people because they're not getting tested.
Now, this is why all of you all in the room, how many of you all have sons, daughters? Raise your hand. Excellent. Look at all these hands going up. How many of you all in this room have nephews and nieces? Raise your hand. Excellent. How many of y'all have godchildren and they poke through, come to your house, don't even live there, but eat your food? Raise your hand. Look at all these folks in the room, right? Listen, I'm going to ask y'all to host some checkup dinners. Go get checked out lunches. Bring everybody over and ask them, when is the last time you've been to the doctor? When's the last time you checked yourself out? Because particularly, not exclusively, but specifically, in black and brown communities, we don't go to the doctor. Now, how many of y'all know at least one man who you love in your family, whether it's boo, bae, or nephew, them, they ain't been to no doctor? Raise your hand. There you go. And men, those of us that are in the room, we need to make sure we hold each other accountable. Hey, bro, have you gone to get checked out? Have you gone to let them take a look at you? And these things that we try to hide from, it's kind of like bad credit. You ain't going to fix it without checking it. Right? We got to be honest and we have to be adult about that. And so now that you've educated us on the STD and the STI, I think you said that it's pretty much the same thing, but it needs to be addressed. Everybody say it needs to be addressed. Don't touch about 3 people say, get checked out, get checked out, get checked out. Get checked out. Now, we can laugh a little, but as we laugh a little, I'm hoping we can live a lot. Right? By addressing all of our health issues completely. Now, in our conversations, you talked a little bit about PrEP and PEP. Now, that one caught me off guard. I had heard of STDs and STIs, but I had never heard the terms PEP and PrEP. Could you educate us a little bit on that?
All right, so this one I'll talk on. This is an area that I'm very, very passionate about, and that's PrEP. What PrEP is pre-exposure prophylaxis.
Stop right there. Everybody say PrEP. PrEP. Come on, say it again with your preaching voice. Say PrEP. PrEP. All right, he's going to teach us what PrEP is. Say it again.
Pre-exposure prophylaxis. What it basically is, the way I like to describe it is, it's like birth control for HIV. It's pills or an injection that you take, and as long as you're keeping up with it, it can prevent you from getting HIV infection. It prevents new cases of HIV. And one thing that I really want to talk about is when we look at new HIV cases in the city of Chicago, historically there's been a few communities up north that have had really high, a lot of new HIV cases, looking at Lakeview, Uptown, and Edgewater. And then there was several communities down south, looking at South Shore, South Chicago, Roseland, Grand Crossing. And what we've seen in the last several years is those rates up north are going down. Those areas around Boys Town, the HIV rates are dropping up there. They're no longer in the red. And the main reason for that is they're taking PrEP. We have PrEP available on the south side, but not as many people are taking it. And that is one of the greatest tools if you are at risk for HIV. One of the greatest tools you can do is take that pill, take that injection, and it is very effective at preventing HIV.
You know, one of the things that I'm really concerned about is stigmas, right? And a lot of times we label one particular group as the ones who will be mostly impacted by this. But that is ignorance. That is a lack of knowledge. And whether you're heterosexual, homosexual, the reality is everybody can be impacted by this. And we got to get rid of the labels that keep us ignorant. Now, here's what I hope we just heard. It's on the south side. Right? Abundantly clear, it's on the south side. Right? And we need to understand, y'all remember when COVID first came out? And remember at first, black people were saying, well, we can't catch it. That's white people. And then when one black person got it, I think it was Idris, and Idris Elba got it. And then other folks start saying, wait, hey, hold on now. This showing up in black people. Listen, my brother is an HIV positive advocate and has been an ambassador for many years. And I want to take a moment and just thank my baby brother, Joshua, who has been an ambassador for the HIV community. And then as a pastor, because it affected my family, and this is not private, he's public about it. He goes everywhere and talks about it. And we've done the walks with him and all of that good stuff. And then I got connected to the AIDS Foundation because it showed up in my family. And so I became an HIV AIDS ambassador. Awesome. They put my face on all of the bus stops, and I got so many calls. People start calling me, I'm like, you good? You know, you all right? And people were wondering if I had HIV or AIDS. And the answer was no. But I can't see something and not say something, because there are people in my congregation, people in my family, people in my community. And so all of us should be ambassadors for the messaging when it comes to our health. We cannot, now let me say this as a pastor, we cannot just say no sex. Because clearly people are not listening to that message. And neither did I. We cannot just say safe sex. Because clearly people are not adhering to that message. Y'all won't like this, but I'm going to say it. Whether you have influence just in your house, on your block, or in God's house, we better be giving some education on how to have sex. We have to do it. Or we are not properly informing people. We're not properly informing people. Now, listen, I'm not just talking about, because, I got one message in the pulpit. That's my job. But after church is over, listen, I toss some rubbers to my sons. I give my son some condoms like, hey, doc, here you wrap it up. Wrap it up. See, y'all don't like this. Tell my daughters, birth control. We got to talk about that because listen, before I'm a pastor, I'm a daddy. And before I'm any of that, I'm a man. And the reason I was raised up in church, I grew up in church, been in church my entire life, and I pastored the church that I was born and raised in. And my first child, Crystal, who is 31, working around here now. Listen, I got her mama pregnant when she was 16. Raised up in the Holiness Church. But everything I did wasn't holy. See, y'all don't like to talk about this kind of stuff, see? We got to keep it real. We got to talk about it. I wish we would just be open and honest and talk about it. And this is an issue that's showing up in the black community. And thank you for calling out Roseland. And now, this is in the hundreds. Right? And the low end. So we got to be careful that we don't use stigmas to stay ignorant. And we got to educate other people. So that's PrEP. Tell me about PEP.
All right, so PEP is post-exposure prophylaxis, meaning you take it after sex. Say you've had sex with somebody and now you're concerned. You think that maybe you caught HIV, or maybe it was a case of sexual assault. It's something that will be offered in the hospital if you go. PEP is basically where you go on a month's treatment of HIV. So you're going to take HIV medication for a month. This is the same thing that we do for healthcare workers. If you're talking about a doctor, a nurse, a medical assistant, somebody who accidentally sticks themselves with a needle that may have been contaminated with HIV, they will go on HIV medication. And it will prevent them from getting HIV, and it's very effective as long as you take it within 72 hours.
Y'all ought to be clapping for this kind of information. Listen, we've been up here for a short time, Brittany, and how many of y'all have heard some information that you know somebody in your family friendship circle need to know? Raise your hand. Listen, you are becoming the teachers now, and I hope you will be able to share this information. Now, Brittany, let me ask you a question. All right. I've had sex with someone unprotected, and I kind of feel different. Sometimes that's psychological because you know you were irresponsible or you didn't do it the right way, the right thing, whatever. Can I go in the mirror and look at myself and see if I got an STD? Like, does it show up like that? Listen, we better stop going off of our feelings. That's why we have to be in tune with our healthcare issues so we can operate with facts. How do STDs show up? How do they present themselves?
Do you mean where in the body?
Well, how do they present themselves? Where in the body do they show up?
Oh, okay. So, yeah, that will be...
Or Warren, you want to pick it up?
It can present multiple ways, right? And it's going to depend somewhat on the type of sex that you're having and what it is that you may have contracted. A lot of people think oral sex is completely safe, and that's not really true. HIV, you're much less likely to get HIV through oral. However, other stuff you definitely can. And while we're talking about seniors, last summer there was a huge outbreak of syphilis in Chicago, mostly centered around Roseland, and it was in the 50 and over population. Is where the outbreak was, and it was mostly being contracted through oral sex.
All right, stop right there. Now listen to this. The age was what?
50 and over.
Okay, one more time. The age was what?
50 and over.
So I want all y'all to stop blaming everything on these young people. Oh, y'all done got quiet. Now, y'all better clap right there. I won't pass out another gift card nowhere. I want all y'all that's 50 and above. Stop tripping on these young people talking about, you know these young people crazy. You know these young people something else. Clearly, it's some seasoned folks that's something else. Y'all hear what I'm saying? The age group was what, y'all? 50 and over. Now, this is serious for you to hear. Keep on, Warren.
So, last year, our Roseland Clinic diagnosed more cases of syphilis than some entire states.
Now let's pause for a minute. Boy, see, this conversation will push you a little closer to celibacy, won't it? Listen, it'll make you think differently. Listen, I know we're talking about a grown folks conversation today. But boy, we better be talking about this. We better be having this conversation. Because what he just said is, in one clinic, more than the whole state, this is serious. And what I hope it does is it pushes us to a place of responsibility. Pushes us to a place of responsibility. We cannot afford to be reckless. Because we don't know where what is and we don't know where who been. Right? Can I say it again? We don't know where what is, and we don't know where who been. So we got to make some serious decisions. And listen, I hope you all will go home. I hope we will all leave here and go talk to other people about it. Not in an accusatory way, but just say, hey, let me tell you what I learned today. Can you believe? And give them these stats. Go ahead.
So our clinic there in Roseland, we beat out the state of Wyoming as an entire state, and at least one of the Dakotas. I think it was both of the Dakotas. I have to check the data again. But there's a lot moving around. And the thing about syphilis is when it first appears on the body, it appears as a little sore that's going to be around where you were infected. It can be on the mouth. It can be on the genitals. And it only lasts for a week or two, and it goes away, and it doesn't hurt. And so a lot of times people don't think anything of it. But that's when it's entered its next phase. And it can be sort of dormant in your body for a while until it starts coming back. And then you're looking at getting, a rash, usually on like your hands and your feet and things like that. And then it can progress far enough along that it can cause, brain damage. It can cause problems with your vision. That's what Al Capone had, way back in the day, and what he had ultimately died from. It's a very dangerous infection, but the good news is we have a cure for it. You just need to get tested, and you need to come in and get the shots, to be cured from it. But that's why it's so important to get tested. Another issue is that we see it a lot in pregnant mothers. And each year, there's usually over 2,000 babies that are born with syphilis every year. And it can be very, very dangerous. Congenital syphilis is a huge issue. That's why pregnant women are routinely screened, and that's why it's so important you get that prenatal care and stuff, because usually the cases, they're people who never got any care until they had the baby, and now the baby is born and needs to be treated.
Warren, do me a favor. List different STDs. Because we talked about syphilis, we talked about HIV. Just give a list of the various STDs and STIs if you can, because knowledge is power. Everybody say knowledge. Knowledge is power. Now I want to talk before we leave here, before we end this out, on how to present the conversation. Because you can't go home, first of all, to some person you love and say, "Boy, you got anything?" "Girl, don't you bring nothing in this house." No. You can't do that, right? You got to present the conversation in a positive way, not a punitive way. You got to have the conversation, say, listen, I just want to make sure you're healthy, right? Because before, and let me talk to my church mothers and church deacons and things, before you talk about them being holy, because I know that's how we present it, This is about them being healthy. Right? This is why a pastor is up here talking about health issues. And we got to know what's going on so we can educate people. Give us a list. Just educate us today, because I think we only focus on a few.
All right, so probably one of the most common ones is chlamydia. There's over 1 million cases of it a year. It's very common, but it's very easy to treat. A lot of times with men, there are no symptoms. You don't know that you have it, but it can cause serious complications for women. And we've even run into things where, women have come back positive for chlamydia, and they get treated, and they tell their boyfriend, hey, you need to get treated. And he's like, I feel fine. I don't need anything. It didn't come from me. It's not a problem. And refuses treatment, and then they have sex again, and she catches it again. So it's important to understand a lot of times you don't know that you have it, but just because it's not affecting you doesn't mean it's not going to affect that other person. All right, so chlamydia is one. The other one is gonorrhea. Gonorrhea is also very common. It's common around the world. It's something that there's being a lot more antibiotic resistance to it, but we still have fantastic treatment for it. You can still get cured. It's a little more serious. It requires an injection usually of antibiotics to cure you from it. That one, there's usually some sort of a discharge, and a lot of times, it is symptomatic, but occasionally, again, sometimes, people don't know. And the other thing to keep in mind is that you can receive gonorrhea and chlamydia both through oral sex. And if you are positive orally, let's say you always wear a condom when you have regular sex, but you're not using a condom orally, you can get it in your throat, and that will not show up on the urine test. That will not show up, on a swab. That'll only show up if you swab the mouth. And so sometimes if you have a sore throat, maybe you're thinking it's strep, maybe you're thinking it's the flu. If you're negative for all that stuff, it's possible it could be an oral STI.
Can we just take a moment and clap it up for Warren and Brittany coming here to educate us on what's going on? So it sounds to me like STDs, STIs, Brittany, are not gender biased, not race biased, don't care what socioeconomic environment you come from. It doesn't matter what zip code you live in. These are issues for humanity and not exclusive communities. Does that make sense? How would you say we get the messaging out to the younger generation and the older generation? What things can we do to get the message out?
I think just things like this. Having things like this. And then, like Warren said, too, we're in a high school over at the CBCA. We do presentations at the Ombudsman School, just getting the information out there and then giving them an opportunity to come see us.
I think the other thing is we could have these conversations in churches. We should have these conversations at home, at the dinner table. Those of y'all in the room, tell me, what other places should we have these conversations at? Schools. What else? Community centers. Where else? In senior homes. Where else? Everywhere you go. At the bingo game. Right? See if y'all respond the right way. At the power session. This is what we ought to be talking about here. Now, I remember when HIV first came out, AIDS first came out. And when it showed up in my family and in my house, we did not know how to respond to that. Later on, I had to even go back to my brother and I had to apologize to him because we just didn't know how to handle it. I think across the pulpit, preachers didn't know how to handle it. We were not trained. The church didn't know how to handle it, right? And some of the behaviors that I saw and participated in back when HIV and AIDS happened, it blew me away because that's exactly how we also treated people when COVID happened. During COVID, 2020, wasn't nobody shaking nobody's hand. Nobody's giving nobody no hug. You wasn't even in no church, so wasn't no slap your neighbor high five. And how many of you all stopped loved ones and family members from coming to your house? It was a real thing. And here's the question. How did that feel? Right, look at all these faces. Look at all. It was a terrible feeling. So imagine what they felt in the 80s and in the 90s. And when we are not prepared to handle circumstances, we mishandle people. We mishandle people. And the way of living back then, 80s, 90s, is way different now. I mean, my brother kicking it. He was just at the Grammys. When my youngest brother won 2 Grammys, and my brother was right there with him. My mama was there on the red carpet with the church hat. I mean, the woman wore a whole church white outfit at the Grammys. And I'm like, man, life is so different. I remember when Magic Johnson. Y'all remember that? When he made the announcement that he had HIV/AIDS, and everybody treated him different. And that man's so healthy, looking good, owning every business all over the place. Talk to us about how life is different now versus then when it comes to HIV/AIDS.
So things are very different now than they were in the 80s and 90s. HIV first started coming to awareness in 1981, and back then it wasn't even called HIV. We didn't have that name for it yet. We didn't even know what caused it. Eventually the virus was discovered, but we still weren't sure of all the ways it could be transmitted. Now, in reality, there's only 4 bodily fluids that will transmit HIV. There's blood, there's semen, vaginal secretions, and breast milk. That's it. It's not in saliva. It's not in urine or anything like that. There was always concern, could I have gotten it from a toilet seat or something being dirty in the bathroom and stuff like that. It's not from any of that stuff, okay? It's only from those 4 bodily fluids. But we didn't know that back then. We weren't sure. We weren't sure. Could you catch it from kissing somebody, from being close to somebody, sharing glasses and cups? So you had people, if they were HIV positive, nobody wanted to touch them. Nobody wanted to hug them. Nobody wanted to eat dinner with them. Or, there'd be families that they'd all be eating on regular plates, but the HIV positive person had to use disposable plates, disposable cutlery. We didn't know. But now we do know that you can't catch it through casual contact like that. So we know a lot about it. We know how to detect it a lot quicker. It used to be you'd get a test for HIV, and you'd have to wait sometimes a couple weeks before you get that result back. Now we can get it in under a minute. We'll be offering tests today. Under a minute, you can get an HIV result, right? So it's a lot different, and we are able to treat it much better. We can treat it, you used to hear about the HIV cocktail. There'd be multiple medications you'd be taking that would make you really, really sick. Now you can take 1 pill a day, and it can treat your HIV. You can take what's called long-acting injectables, where you just get an injection every 2 months, and that treats your HIV. And probably the most significant thing that we have is now you can get what's called an undetectable viral load. So we're able to measure how much HIV virus is in your body through a blood test. And you can get what's called an undetectable viral load, meaning less than 20 copies of the virus per milliliter in your blood. And when somebody is undetectable, they can no longer pass HIV on to another person. And that is a really key, that's a really big point. There are people that are HIV positive, married to somebody who is HIV negative, and that HIV negative person does not get HIV.
Look at all these folks in here. Everybody's like, wait, what? Wow. See how much information you would not have known had you not come to this power session? If you learning something today, make some noise all over the room. Now, tell people, like, you got to be smart, you got to be selective, right? You absolutely have to be safe, right? That's vitally important. Now, for those that say, this does not apply to me, you don't know who you know who may be a person who needs this information right now. Because I'm sorry, nobody just comes up and offers, hey, did you know I got? That just doesn't happen. So having these conversations should be normal, not abnormal. And if we have these conversations, I'm going to see if I can say this and get anybody to agree by way of a hand clap. If we have these conversations proactively, we won't have to have them reactively. This is good information. And I'd rather have it and not need it than to need it and not have it. Now there's another thing as we get ready to wrap up. I was amazed. I've been doing this work now. Bright Star Community Outreach has been around for 14 years now. And we did a big push. And some of the people in the room will remember this. We did a big push on something that I couldn't believe was affecting the black community. I had never heard of it. Hepatitis C. I was floored how many folks in the black community struggled in this particular area. Can you both teach us a bit about hepatitis C?
All right, so hepatitis C is a virus that affects the liver, right? And it's actually most prevalent in the baby boomer population, so people born mid-40s to mid-60s, right? And a lot of people have had it. It's another thing you can have for many years and not realize it, and it may not affect you until several years down the line. And that's why it's recommended that everybody gets screened for it, but particularly if you were born between 1944 and 1965, because it's just so prevalent in there. A lot of times we didn't even know that it existed while it was getting spread around. It wasn't discovered until the late 90s. And, you know, I'm a veteran myself, and I used to work in a...
Thank you for your service.
Thank you. I did spend some time in a veterans disability clinic, and we'd have people who came in, they contracted hepatitis C or they contracted HIV while they were in the military, because back in the 80s and the early 90s, before they knew better, they used to reuse needles on folks. So there was people who caught this stuff during their time in the service. They got it in boot camp, you know, from the shots that they were getting. They don't do that anymore, obviously. But we didn't know as much back then. We weren't as careful. So it's really important to get screened for it, you know, just to make sure. And the good news is now it is one of the few viruses out there that we actually have a cure for. It's really hard to cure a virus, but there is a cure for hepatitis C. Now, most people who got it, they got it through some sort of a needle use, maybe sharing needles and things like that. But it can definitely be spread through sexual contact too. So it's one thing, and also a lot of people who have gotten tattoos or piercings, particularly in like the 90s or before. Sometimes a lot of those piercing studios, those tattoo parlors, they weren't using fresh needles for every person. And so there's a lot of people who got it, you know, many years ago from those sort of institutions.
Now, I want to just stick a pin there because this is still an issue right now. And, you know, you're going to get your homie to ink you up. That's getting a tattoo. And you ain't checked that whole thing out. You have no clue how clean they are, how safe they are. And I want to make sure that people don't walk out of here thinking this is an issue that was just prevalent in the 80s and the 90s, right? People who do tattoos still don't always use safe tools now. Because in order to be safe, in order to be clean, you absolutely got to pay the money to do that. And a lot of times they want to make the money, but they don't want to pay the money to make sure that there is safety. And so I think this is very, very important. I just want to pause for a moment and just share. This is why Bright Star Community Outreach, we're getting ready to repurpose a school right across the street, calling it the Turn Center. And we're going to be repurposing this particular school. And what you see on the screen right now is a facility that we're going to focus on. One part of the school will focus on the social determinants of health, all things health, even educating students and adults, young people, older people about these kinds of things. We're also going to use one section to focus on behavior health, peace circles, and restorative justice. And then on the other side, we're going to be teaching and using that particular section about workforce development, making sure that we train up the next generation, older people and younger people, to be able to become health professionals. This is what I'm excited about. And we're going to be repurposing the school so that we can not only keep people alive, but also increase their quality of life. Because if I'm alive and ain't healthy, that's not living. No. I don't just want to live. I want to live well. I want to live healthy. And I'm excited about that. So today, I'm going to ask everybody in this room, would y'all please do me a favor? Would y'all go crazy for Warren and Brittany from Chicago Family Health Center? I'm excited. Y'all, come on, y'all give them a standing ovation. Power, let's show them some love for coming to educate us today. That's right. Make some noise for them. I can't thank y'all enough.
Thank you.
So grateful. Now listen, we get ready to go to a commercial. Y'all get ready to win some more money. And I'm really, really excited about this. And I want to put in a quick commercial. My man, 50 Grand, is in here. He is not only the pastor of Glorious Light Church, he is also the founder and CEO of the Timothy Community Corporation. Now they have the Timothy Center. They did it first. They repurposed the school, Drake Elementary. Do me a favor. Would you turn that camera on this pastor right here? Y'all go crazy for Pastor Mike Neal. Come on now. Y'all do better than that, Power. Now listen, you can go over there. Listen, you can go over there and work out at the Timothy Center. We're going to let him give that information today before he leaves. But listen, it's free, all of that good stuff. But I'm excited about us not only living, but all of us living well. One more time before we go to a commercial break, will y'all please go crazy for Warren and Brittany? Come on. Thank y'all. Check out this information about what we're doing at BSCO around health. When I went to Israel in December of 2012, I saw a place called Natal in Tel Aviv. And what blew me away was the fact that they had people in Israel that suffer from PTSD. But while they worry about missiles and sirens there, we're counting body bags and toe tags every single day in Chicago. So I decided I wanted to bring back to Bronzeville what I saw in Israel. One of the things that prompted this work is the fact that there's this vicious cycle of violence. And folks were asking, why does this happen? That's why we have to do the trauma counseling work.
So, we know that hurt people, and so we end up as advocates, we end up as wounded healers.
The reality of it is to ask for help is actually showing strength. It takes a strong person to ask for help, to need, to show that they need help.
We have so many people who really don't believe that there are certain resources that are available to them. And with the help and the partnership that we have with Northwestern Medicine, it's been able to really open their eyes to other resources that they can take advantage of to really empower them.
I shared with you, I'm a son of the soil of Bronzeville, raised up in the Dearborn homes, 2930 South Dearborn. So I work, worship, and witness in the place that I was born and raised. And that's really exciting. So when you think about Bright Star Community Outreach's turn model, it's 5 core competencies: counseling, mentorship, parenting, workforce development, and advocacy. With BSCO and Northwestern Medicine partnering, the one statement that I would make is game changer. Northwestern Medicine comes in to say, hey, listen, we want to be a part of the process of healing the community, helping the community become healthy. And one of the best ways they've done that is educating the community.
I am really happy to hear that you're absolutely reaching out to people and definitely doing something. That is amazing.
I've been born and raised in Bronzeville, and I can honestly say that organizations like Bright Star, I've seen change youth and entire communities.
Don't come and do it to us, come and do it with us. And that's what Northwestern Medicine has done.
All right, clap it up, everybody. Do you feel empowered? You should be full on information and this good lunch you had today. Can we put our hands together for our awesome CEO, Pastor Chris Harris?
Which table had the fried lobster?
Fried lobster?
No. Oh, that's not this room. I'm sorry. Okay, all right.
I really hope. Let me just step in here.
Come on.
Because you know how you can be sometimes.
All right. Tell them.
So let me just say that the information that you received today, if you want to be tested in a private environment, our table back there, they're going to be upstairs to test you. They do have some giveaways also. So if you would like to be tested in a private space, they're available to do that. Did you enjoy them today? Woo. Listen, before we do our bingo, we have our Pastor Mike that's going to come talk about TCC. We're going to put our hands together for Pastor Mike Neal. Let's give it to him.
The next 2 Saturdays at the TCC, the Timothy Community Corporation, we have free health fairs. This March is Lymphedema Awareness Month. So the TCC is located in the former Price School, 4351 South Drexel, just a couple of blocks away. This program starts Saturday from 1 to 4. It is free, and just as you got information today, there'll be even more information because, ignorance doesn't make us bliss. Ignorance just makes us ignorant. All right? Then number 2, on the 25th, there's a wellness fair as well hosted by the Man Cave. And so that's going to be free, and it's going to be from 9 to 11 next Saturday, the 25th. You can get all this information on our website, timothycommunity.org. And then also, I'm going to throw something back at Pastor Harris. We do have fitness classes. We have spin, yoga, kickboxing, Zumba. But today, what I want to offer, power. We ought to have us a special power session of Zumba, all right? Who would like to do that? Raise your hand if you'd like to do that. All right, so I'm going to talk to the people in charge, and we're going to set that up. You're going to come over and Zumba because after you have all this good eating, you got to exercise. Because no matter what happens, the one thing we have found in any disease or anything that goes wrong in our community, whether it be diabetes or heart disease, the one thing they always encourage is movement and good eating. All right? So we'll talk about the good eating, but we're also going to make you move, okay? So I'm going to work with Pastor Harris and his team, and we're going to set it up and have us a Zumba session. But all our other classes are very low cost, anywhere from $5 to $10. So you can't beat that. We spend that much on our nails. Just to walk in the nail shop costs you $5, right? So consider that. I want you to check us out at timothycommunity.org, and we're going to have that Zumba session real soon. Look forward to talking to you. God bless you.
Come on, clap it up for Pastor Michael Neal. That sounds kind of good. I might have to get over and get my Zumba on.
I cannot wait to get over there and watch you do that. I cannot wait to see.
Who came to play power today? Let me hear you. Clap it up. We got a gift card for somebody. You ready to play your power bingo? Is Yana in the house? Yana.
Let's get him out.
Come on, put your hands together for Yana Harris. Isn't she lovely? Hey, Jan. We're going to let you do this part because you do it so well. If you want Yana to pull yours, say something. Tell her.
First word is variant. Variant.
I like that.
second word, budget. Budget.
Shake it up a little bit. Shake it up. Shake it up.
Third word is workforce. 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 Fourth word is savings.
Yana, you just put that lip gloss on. That thing is popping like that. I know you just did that.
Savings.
Ain't no way. You just did that, Yana.
We got a free space. Free space.
Make it count. Line it up with the ones that you already have. What? Let me see. Come on up here, let me see. She got her pennies on there. Sure do. Put your hands together for her. Oh, yo, that was weak. I said put your hands. Well, clap it up. We celebrate. You. I'm having an awesome time. I'm so glad you could be here with us.
I am glad I'm here too.
Listen, to see this space on just a Wednesday afternoon, I don't get to do that often.
I'm just glad to be here.
Let me just get myself together. So, one more time, please check your HIV status. If you feel comfortable enough to have sex with someone, feel free to ask about your status. You can do that here today. Our group is right in the back. They'll take you upstairs and check you out. It won't take long at all. Are you having a good time?
I am.
Are you?
I am.
All right.
I'm just glad to be up here with you.
Listen.
Y'all, excuse me. I'm sorry.
All right.
This is my wife.
Let me get back on task here. So, your referral forms, you know how they can win. You saw somebody win on a referral today. I hope that's filled out. And my fellow employees, raise your hand if you're available. We'll come around and pick up the referral forms from you. Also, what information does our community want to hear about? Do you see that sheet? They'll come around and get that also. If you could get that ready for us, we're going to give you about 5 minutes to do that. What information, according to this little half sheet right here, do you want to hear more about? So we can bring it to you. We want to work with you, not bring information just because we want to.
And we want to talk to those online. You're watching. Also, some of the choices is trauma-informed care, mental health, education, workforce development, mentorship, health and wellness, partner community organization, funders, financial literacy, and public safety. We'll list that online. Please help us help you so we can talk about meaningful subjects while we're gathered here. And those online, we love that you're watching.
Yeah.
But we would love for you to be in the room also.
That would be great.
All right. Come on, honey.
We got one more drawing. Did you have a good afternoon? See, we don't hold you long. We fill you up and let you go and give it back to your family and friends. But we're at our final drawing right now. We're at the final one.
Get your tickets out.
Get your tickets.
Get your tickets out.
If you're on Facebook and YouTube, you should be here, especially if you live right around the corner. Because we feed you good. Did you enjoy your lunch today? Did you enjoy the person you sit next to today? Would y'all take a selfie of each other and post it up?
QR code right on the screen.
QR code is right there for your feedback. So how do you do that? You're asking me, how do you do that? You would take your phone and take a picture of that. You'll see a gold bar that comes under the picture. And then you click the picture and a survey will come up for feedback. We ask you questions like, how did you enjoy yourself? What's your number? No, I'm just playing. It will ask you information that will help us better serve our community. We appreciate you so much. We know we ask you to do a lot, but when you give a lot, expect to receive a lot also. So that's why we need your help with the feedback code. And also, if you have not registered for next week, do it now.
Do it now.
Your flyer is right there with the QR code to register. So guess what? This is what I need to say.
What's that?
We're going to be here for the rest of the month of March every Wednesday. Have you been enjoying this program? And we promised you that we would be here for the rest of the year, did we not? And we will, but this is what we're going to do. Beginning in April, we're going to be here on the 2nd, make sure you mark your calendar, and 4th Wednesdays. It will no longer be every week.
Somebody praising God back there.
Somebody's praising God.
Somebody is shouting.
The 2nd and the 4th week. Now, this is what you really need to know, is what we are anticipating is extra people. So it's important for you to register right away so that you can get a seat, because we would hate to say we're booked, we're full. We haven't done it up to this time, but that's our anticipation. So please register for next week today. For the rest of the month of March, we'll be here.
Yes.
But
Let's
starting in
reiterate that. We will be here next week.
We will be here next week.
We will be here next week.
We will be here.
Somebody repeat after me. Starting in April. All right, y'all got it.
So 2nd and 4th week of April is when we will meet again. Not on the 1st and 3rd, the 2nd and the 4th. That gives us time to better coordinate everything.
Let's give away some money.
Yeah, let's do it.
Y'all
Come
ready?
on, let me hear ya.
Oh, y'all don't want no
They don't
money.
want it.
Stop playing around. Let's say it one more time. Are y'all ready to win some money? Where's the winner? Where's the winner? You know, last week somebody put it on there. I'm going to win. All right. Where's your expectation? Here we go.
Hey, come on. Hey. Let me hear ya. If you want to win, let me hear ya.
All right. The number is, I can see it, 588-3529.
Where's the winner at? All right, we're going to pull again. Christian, pump it up for a minute. Come on, who wants to win?
Nobody want that?
Let me hear you say, hey. I say, hey. Hey.
All right, here we go. Yeah. Turn that music up one more time. Wave your hand in there. Come on. Come on. Somebody in the back ain't waving your hand. Come on. Hey, hey. Turn that music off right now. Here we go. 588-3536. Hey, she won again. Hey. Let's see the ticket. 588-3536. My God. My God.
And y'all remember, she was a referral. Come on,
Lord
clap it
have
up.
mercy. You see that young lady back there? Is that what we doing? You want her
You
to
gotta
come up?
verify.
You gotta verify?
Pump it up, y'all. Somebody say power.
We got a winner.
Say power. We got a winner. Hey.
She won it. Shakira, go see Shakira. Raise your hand in the back. She won earlier. My Lord.
Yeah.
I better take her to Indiana real quick, huh?
So.
Take her over to that boat or something.
Bishop.
Something on her.
This concludes our week's fun. Did you enjoy Power today? Clap it up for our CEO, Pastor Chris Harris, to our guests from the Chicago Family Health Center. Come on, clap it up for our guests today. And give yourself a round of applause.
Yeah.
We'll see you next week. Stay in
See
power.
ya.